Before you do anything else today, I want you to go to a mirror and look closely at your pupils. Most people think heart disease is invisible, but your eyes can actually act as a window to your cardiovascular health. Today, I'm showing you 3 specific signs, including a gray ring most seniors ignore, that mean you need to see a cardiologist immediately. I want you to look in a mirror right now, not to check your hair, not to see if you look tired. I want you to look at your eyes. Because what I'm about to show you today is something that most people walk past every single morning without realizing. Your eyes, the ones staring back at you in that bathroom mirror, may be quietly showing signs that your heart needs attention. And the remarkable thing is, this isn't new science. Doctors have known about this connection for decades. It just never made it out of the medical office and into everyday conversation. My name is Dr. Eyelid. I've been practicing cardiology for over 10 years. And today, I want to change that. Think about your morning routine for a second. You wake up, you shuffle to the bathroom, you splash some water on your face, you glance in the mirror for a few seconds, maybe check if you look rested, maybe not, and then you move on with your day. Most of my patients do the same thing. Patients in Tampa, patients in Phoenix, patients all across the country who are managing their heart health, taking their medications, doing what they've been told, but not one of them was ever taught to actually look at their eyes as part of that routine. And I'm going to tell you today, that's a missed opportunity. Because your eyes are one of the few places in your body where certain internal changes become visible from the outside, without any test, without any equipment, just a mirror and 60 seconds of your time. Stay with me. Because the 3rd sign I'm going to share is the one that surprises my patients the most. Now, before we get into the signs, I want to be clear about something. Nothing I share today replaces a visit to your doctor. What I'm giving you is awareness, a reason to pay closer attention, and a reason to start a conversation with your physician if something looks different to you. These are signals, not diagnoses. The eye and the heart are connected in ways that most people never learn about outside of a medical textbook. The blood vessels inside the eye, the retinal vessels, are actually the only blood vessels in the entire human body that a doctor can see directly without surgery or imaging. Think about that for a moment. When a cardiologist or an ophthalmologist looks into your eyes, they are literally looking at your blood vessels in real time. And what those vessels look like, their width, their color, their condition, can reflect what's happening in blood vessels elsewhere in the body, including the ones around your heart. This is why routine eye exams are so valuable, and why the American Heart Association has highlighted the retinal examination as a window into cardiovascular health. But today, I want to talk about what you can observe yourself. Not the deep internal vessels. Those require a doctor's examination. But surface-level signs, visible changes, things that show up on the outside of the eye that are worth knowing about. Let's go through them one by one. The first sign is a white or grayish ring around the outer edge of your iris. The iris is the colored part of your eye. The ring in question appears just inside the white of the eye, forming a circle around the outside of that colored area. This is called Arcus senilis. And before I explain what it may indicate, I want to be clear. If you are over 60, having this ring is relatively common and is not automatically a cause for alarm. In older adults, its presence alone is considered fairly normal. But here's where it gets important. If you are under 50 and you notice this ring, that is something to bring to your doctor's attention. Because in younger individuals, Arcus senilis has been associated with elevated cholesterol levels. Specifically, it can be a sign that lipids, fats, have been depositing in the tissue of the eye. And if they're depositing there, that process may be happening elsewhere in the body too, including in your arteries. Elevated cholesterol, when left unaddressed over years, is one of the primary contributors to plaque buildup in the arteries, a process called atherosclerosis. That buildup narrows the arteries, makes them less flexible, and puts strain on the heart. I've had patients in their 40s come in for routine visits, and when I've asked if anyone had ever mentioned the ring around their eyes, they had no idea what I was talking about. Yet their cholesterol panel came back significantly elevated, The ring was the first visible clue, and it had been there, in their mirror, for years. What you can do, if you notice a white or grayish arc or full ring around your iris, especially if you are under 50, mention it at your next doctor's visit. Ask for a lipid panel if you haven't had one recently. It's a simple blood test, often covered under Medicare wellness visits and most standard insurance plans. It takes minutes and tells you a great deal about your cardiovascular risk. This is worth catching early. The earlier you know your cholesterol picture, the more options you have. The second sign is yellowing of the whites of the eyes, or small yellowish deposits near the inner corners. Now, yellowing of the whites can have several causes, and many of them are liver-related rather than heart-related. So I'm not saying that yellow eyes mean heart disease. That would be an oversimplification. But there is a specific condition called xanthelasma, and this one is directly connected to cholesterol and cardiovascular risk. Xanthelasma appears as soft, yellowish, slightly raised patches. They tend to show up on or around the eyelids, most commonly near the inner corners of the eyes, close to the nose. They are cholesterol deposits, visible ones, right there on the surface. Studies have found that people who have xanthelasma have a higher likelihood of having elevated LDL, that's the less favorable type of cholesterol, and a statistically higher risk of cardiovascular events over time compared to people without them. Here's what most people don't realize. These deposits don't hurt. They don't blur vision. They don't cause any discomfort. So people often notice them, assume they're just a cosmetic thing, and do nothing. Many of my patients in Arizona have pointed them out to me almost apologetically, as if they were just an aging thing. And I always say the same thing. I'm glad you mentioned it. Let's check your numbers. Because xanthelasma is your body showing you, on the outside, what may be happening on the inside. What you can do, if you notice small, soft, yellowish patches near your eyelids, bring it up with your doctor. Don't wait for your next routine visit if you've had them for a while and haven't had a cardiovascular workup. A lipid panel, a blood pressure check, and a basic metabolic panel together can give a very clear picture of where your heart health stands. These deposits are sometimes removed for cosmetic reasons, but removing them doesn't address the underlying cholesterol issue. That's the conversation worth having. The third sign is one that surprises almost everyone when I bring it up in the office. Tiny, visible red lines in the whites of the eyes, not the kind from a bad night's sleep, but persistent ones that don't go away, can sometimes be worth paying attention to in the context of blood pressure. Let me explain. The whites of your eyes, called the sclera, are covered in very small blood vessels. Under normal circumstances, these vessels are barely visible. But when blood pressure is consistently elevated, these small vessels can become engorged and more prominent. This isn't a definitive sign of high blood pressure on its own. Red eyes have many causes: dryness, allergies, strain, infection. So I am not saying that red eyes equal heart disease. That would not be accurate. But here's the context that matters. Many seniors are living with what's called white coat hypertension, where blood pressure reads normal at the doctor's office, but is actually elevated throughout the day. Others have blood pressure that fluctuates significantly. And some have consistent hypertension that simply hasn't been caught yet because they haven't been checked recently. If you notice that the whites of your eyes frequently look red or irritated, without an obvious cause like allergies or screen time, and you haven't had your blood pressure checked in a while, that is worth addressing. Consistently elevated blood pressure, over months and years, puts strain on blood vessels throughout the body. The eyes, the kidneys, the brain, and the heart are the organs most affected, and the eyes often show the strain early. This is critical. High blood pressure is sometimes called the silent condition, not because it has no signs, but because its signs are subtle and easy to explain away. A blood pressure monitor at home costs between $25 and $40. You can find them at any Walmart or CVS. Checking your blood pressure twice a day for 2 weeks and bringing those numbers to your doctor gives them far more information than a single clinic reading. What you can do. If you've noticed persistent redness in the whites of your eyes and haven't had a blood pressure check recently, start there. It's the simplest, most accessible first step. Now, I want to talk about something that ties all three of these signs together, because they all point to the same underlying issue: cholesterol, blood pressure, inflammation. These three things work together. And when even two of them are running high at the same time, the cardiovascular risk compounds. The reason the eyes are such a useful window is that they share the same network of small blood vessels that supply the heart, the brain, and the kidneys. When something is affecting that system broadly, elevated fats in the blood, elevated pressure, chronic inflammation, the eyes tend to show it. Not always dramatically, not always obviously, but visibly, if you know what to look for. Here's what most people don't realize. A standard Medicare annual wellness visit covers a review of cardiovascular risk. It covers a blood pressure check, and with a referral, it can cover an eye exam. All of those together, done once a year, form a simple but powerful early detection system. Many of my patients tell me they put off their annual visit because they feel fine, and I understand that. When nothing hurts, it's easy to delay. But the conditions that do the most long-term damage to the heart, elevated cholesterol, slowly rising blood pressure, early arterial stiffness, these typically don't hurt. Not for years. Sometimes not until a major event forces the conversation. That's why what you can see matters so much, because it gives you a reason to act before you feel something. Let me give you a simple routine, something you can start tomorrow morning. When you go to the bathroom and look in the mirror, take 60 seconds. Look at the outer edge of your iris. Is there any ring, white, gray, or pale, circling the colored part of your eye? Look at your eyelids near the inner corners. Are there any soft, slightly raised yellowish patches? Look at the whites of your eyes. Do they look clear or persistently red in a way that isn't explained by tiredness or allergies? You don't need to be a doctor to notice these things. You just need to know what to look for. And now you do. If you notice any of these signs, especially if you haven't had a cardiovascular checkup in the past year, make an appointment. Mention specifically what you saw. Ask for a lipid panel and a blood pressure review. If you're on Medicare, your annual wellness visit is a great place to start that conversation. This isn't about worry, it's about paying attention to what your body is already trying to show you. I want to come back to something I said at the very beginning. Your eyes are one of the few places in the body where internal changes become visible from the outside. No equipment, no lab, no waiting room, just a mirror, the ring around the iris, the yellowish deposits near the eyelids, the persistent redness in the whites. Each of these, on its own, is not a diagnosis, but each of them is a signal worth understanding. And if you've never been told to look for them before, that changes today. The patients I worry least about are not the ones with perfect numbers. They're the ones who are paying attention, who ask questions, who notice something small and bring it up before it becomes something large. That's what I want for you. Small observations, taken seriously and followed up on, can make a meaningful difference in your long-term heart health. That is not an exaggeration. That is simply what early awareness looks like in practice. If this gave you something useful today, I'd encourage you to share it with a spouse, a sibling, a friend who checks their blood pressure regularly, because this is the kind of information that tends to stay locked in textbooks. And if you haven't subscribed yet, we post new videos every week on heart health, senior wellness, and the simple things that help you stay ahead of problems rather than react to them. Thank you for being here. Thank you for taking your health seriously. Go look in that mirror. I'll see you in the next one.